My name is Paul Heron. I work in the OWLS team, which is it's a study that's it's exploring loneliness. Well, it's exploring many things within people with SMI during the pandemic restrictions. On the right, in the first OWL survey, you can see some of the domains that we've been looking at. But for today, we're just going to be talking about loneliness and social support. And we're also going to look at employment in relation to loneliness as well. All right, so here's just a bit of background about loneliness in SMI. So we don't really understand how prevalent loneliness is in this population. There's been some recent studies in Australia which has found that as many as 80% of people with SMI are also lonely, but we don't know how that compares over here. I've done quite a bit of digging in the literature, and I really can't find much all about loneliness and bipolar disorder. So it seems like it's quite, it's not very well understood. But there's quite a bit of research into loneliness and psychosis and schizophrenia. And it seems like it causes quite a lot of problems for people with these problems. So at the top right there, some of the problems that loneliness can cause for people with schizophrenia. It can reduce quality of life and self-esteem. It can worsen depression and anxiety, and it can worsen symptoms of psychosis. And it can have other effects on the body, like high blood pressure as well. So at the bottom left, there was one study that followed up people with schizophrenia, and it found that people with schizophrenia who were lonely were more than twice as likely to be admitted to hospital for inpatient psychiatric care. And researchers generally agree that psychosis can reduce people's ability to be socially connected. For example, things like stigma or problems arising from clinical symptoms that can reduce people's social support, which then can in turn increase loneliness. And then it's believed that loneliness can actually worsen symptoms of psychosis, and then this can be a bit of a cycle. We know that loneliness is quite a problem for people with SMI, but we don't know how they've been doing during the pandemic. And this is just a group of people who are often a bit underrepresented in general population surveys. So we've explored it with the OWL study. So I'm going to talk through the methods in a moment, but just to give a bit of context, this is a timeline. And on the left, we can see that the COVID public health measures were introduced in March. And today we're going to be looking at data from the OWLS 1 survey, which was conducted in the last half of last year, so between July and December. And we've also got some follow-up results with OWLS 2, but we'll be talking about them on a different day. So today we're just looking at this purple bit, OWLS 1 results. So here's the methods of the study. So participants recruited from the Closing the Gap cohort of 10,000 people with SMI. We used a sampling framework, and this was successfully implemented. So we recruited a sample that was very representative of the general population, in terms of gender and ethnicity and socioeconomic background. Next, you can see a map showing the geographical coverage of where people were living from the participants. So we've got good coverage of the north and the south, and we've got a good chunk of the Midlands as well. The inclusion criteria for participants is on the top right, so adults aged 18 plus, and people had to have a psychosis spectrum disorder such as schizophrenia or bipolar disorder. So at the bottom left, people were invited to complete the survey remotely. They could either do it themselves in their own time using a web link or using a paper copy of the survey, or they could be supported by a researcher and completed it over the telephone. So 367 people took part. We registered the analysis plan in advance, so you knew that we were doing what we said we'd do. And at the bottom right here, it shows the relevant measures that we've used. So we've used 2 measures of loneliness. We've measured perceived social support. And we've also asked people to self-report any changes in their mental health since the beginning of the pandemic restriction, so they could say if things got better, worse, or about the same. We've asked people if they were shielding, and we've asked people if they're professionally active. And for the purposes of this, we've considered that people are professionally active if they're in paid employment, or they're volunteering, or they're a student. So we can compare that to people who are not currently working. So what did we find? So overall, we found that about 1 in 3 people are currently lonely. And you see that the percentage ranges from 29%, which was the single item ONS questionnaire, to 34%. And the 34% was from the ULS 3-item scale, which is validated. So I'm inclined to lean a bit more towards this 34% number. Next, we found that being younger in age was associated with being lonely. And there isn't a picture for this, but we also found that perceived social support was quite similar as well to general population. It was just slightly lower. So overall, yeah, these are quite similar patterns to what you see in the general population. You know, as we've already seen today, then younger age is associated with being lonely. And the portion of people in this sample who are lonely is slightly higher than general population. So I think the March survey, it was about 27% who were lonely, whereas in ours it's about 34%, so it's a bit higher. So at the bottom, we've got some more associations. So firstly, living alone was associated with being lonely, and it was associated with having lower perceived social support. Shielding was not associated with being lonely, and it wasn't associated with perceived social support either. Living in an area of high deprivation was associated with being lonely. And finally, being professionally active was not associated with being lonely or perceived social support, which we were quite surprised about. We expected a job to be professionally active to have quite important influence on people's self-esteem and their self-identity, but yeah, we didn't see any effects on loneliness. So some further findings. As you might expect, lower perceived social support was associated with being lonely. That was a very strong association. And also being lonely was very strongly associated with a worsening in people's mental health during the pandemic. So yeah, people who were found to be lonely in the questionnaire were 3.5 times more likely to have had a worsening in their mental health, which is very strong. But obviously we can't comment on the direction of this relationship. And it may be that a worsening of people's mental health then contributed to them being more lonely. So what do we think of this? Well, we think it's clear that loneliness is a substantial problem for people with SMI, given the previous literature that's saying that loneliness rates are quite high, and given the findings of this study where we found that people with SMI have been more lonely during the pandemic than the general population. So yeah, when we look at the literature, then it's saying, you know, people with SMI have additional barriers to socializing. So what we think might have happened is that the pandemic restrictions have introduced barriers to the general public to socializing, but there was already pre-existing barriers for people with SMI. So what we're concerned about is that once the pandemic restrictions are lifted, then people in general population will find it easier to then go out and to socialize and to reduce their loneliness. Whereas people with SMI, we're concerned that some of these barriers, these pre-existing barriers, will still be there and still find it difficult to do that. So the way to find this out is that we need to follow people up, which is what we're interested in doing, and it's what we're hoping to do and continuing the OWL study to find out how people do post-pandemic. But regardless, we think it's really important to look at ways to intervene. You know, just these points across the top is what we covered earlier. You know, obviously loneliness is a substantial problem for people with SMI. And we think that we need to look towards strategies to tackle loneliness for people in this population. Yeah, typical community treatments for schizophrenia doesn't really address loneliness. And yeah, simply bringing people together isn't enough to help develop friendships. But from what I've seen in the literature, it looks like theoretical models of loneliness that apply to the general population also apply to people with schizophrenia. So any interventions that would apply to general population may also be adapted to or for people with SMI. Yeah, I think this is something that's worth looking into. Yeah, thank you.